Join us now on the news at 5 for more on the Lassa Fever spread and its contamination is Dr. Mary Stephen of the Prevention and Control of Non-Communicable Diseases at the World Health Organization. She joins us from Abuja. Dr. Stephen, thank you for joining us on the news.
Thank you for having me.
Well, so far, the Nigerian Ministry of Health has told us that there have been 40 deaths and 86 cases. Why do you think we're having such figures, from Lassa Fever, knowing the impact it's had before on various communities in Nigeria?
Yeah, usually this is the period for Lassa Fever outbreak. Usually, Lassa Fever in Nigeria it is endemic in some states in Nigeria, and usually the beginning of the dry season, actually you tend to have cases reported from Lassa Fever. So over the years we have seen decline from cases, but this time around we are beginning to see cases, but efforts are ongoing by the Ministry of Health, supported by WHO, to ensure containment of the outbreak and prevent further spread of the disease.
All right, Doctor, can you now tell us, do you think that the Ministry of Health is really doing enough to curb this outbreak? Because it will suggest that, with the alarming rates at which we're recording so many deaths in just a couple of days, it's indeed a worrisome situation we have on our hands.
Well, the Ministry of Health, it's actually on top of the situation. That's the way I would describe it. They are doing their best, and this number of deaths, like you heard from the Minister of Health, majority of the deaths did not just occur recently. The highest number of deaths was reported from Niger, as the Minister said during the press briefing, and the cases had been on for some time, for about 4 months now. So it's a cumulative number of cases that we had from Niger, where we had the highest number of deaths. But the ministry, like I said, they are doing their best. They are also supported by WHO and other partners to ensure that the outbreak is contained.
Doctor, for the benefit of our viewers, let's go over the awareness of Lassa Fever, how to prevent it, as well as how to prevent the spread and how to identify, symptoms of Lassa Fever. Can we just go over that very quickly for the purpose of our viewers?
Okay. Lassa fever, like we know, is a viral hemorrhagic fever caused by the Lassa fever virus. And the reservoir of this virus is a rat called Mastomys natalensis. So usually spread occurs as a result of contamination of food and drinks with feces or urine of these rats. And also it could spread as a result of handling these rats with bare hands. You could also have person-to-person contamination, spread, like an infected person having contact with another person, and then you could have that kind of spread. So basically, how you prevent spread in the communities, you ensure that you keep your house safe and away from rats, and then cover your food and drinks to avoid contamination by the rats. Also, do not dry food materials like they do in the villages. Sometimes they dry food materials in the open, where the rats actually tend to contaminate them. We also, in the hospital setting, you ensure standard precaution and heightened infection prevention and control measures to stop or prevent the spread from one person to another, and also nosocomial infection. That's a health worker contracting the infection from an infected patient. And then lastly, you also do not keep people for the public at home that have fever. Like we heard from the previous presenters, it usually presents with fever, fever that is not responsive to the conventional anti-malarial treatment or not responsive to antibiotics. So it kind of mimic malaria, but if you give the patient anti-malarial antibiotics, they don't usually respond. It also presents with body aches, non-specific symptoms, cough. Then you could have myalgia. Bleeding is a later stage. You have bleeding from orifices, from the nose, from the mouth, in the urine, in the feces, but that's late presentation. But the early presentation is just like any other malaria that you know. It's just that it doesn't typically respond to anti-malarial treatments.
Dr. Mary Stephen, thank you so much for joining us on the news.
Thank you.